My name is Kimmy Mondare, and this is the biopsychosocial assessment on an adult. Hi, my name is Kimmy. I'm going to be your provider today. I'll be performing a biopsychosocial assessment on you. Can you tell me your name and date of birth?
And my name is Blake Beckel. My date of birth is 1/20/1988.
Okay. So I looked through your file, and it looks like you're all caught up on your vaccinations. Did you get your flu shot this year?
Yes.
Okay. Are you fully vaccinated with the COVID vaccine?
I got 3, so I believe, yeah.
Okay, so you have your booster.
Yeah,
Okay,
booster plus.
that's good. And it looks like the nurse has already taken your vital signs, which is good. Your blood pressure is 118 over 70, heart rate is 64, and you don't have a fever, so that's good. Have you been feeling ill at all lately?
Ill? I'd say no.
Okay. Have you been around anybody that's been sick?
No.
Have you done any like recent traveling outside of the country?
No.
Okay. So I'm going to be just going through, I'll be asking you some questions. I'm going to go through some of your history related to yourself
Okay.
as well as your family.
Mm-hmm.
Okay. So whatever you can answer to the best of your knowledge.
Okay.
Um, so what about your parents? Do they have any illnesses or anything in their past medical history that we should be aware of?
Uh, no. Father, no, didn't really know him, but mom has had some skin cancer.
Some skin cancer?
Yeah.
Okay. Is that still relevant?
Yeah, I mean, she gets biopsied, I think, 2 or 3 times a year to
Okay.
get a scan, so.
Okay. Any like high blood pressure that might run in the family or high cholesterol?
No.
Okay. Do you know anything about your grandparents on either side? If they have any pertinent medical history?
I do not.
Okay. Do you have any past medical history that we should be aware of?
Um, Recently I've been checked out for heart arrhythmia, but
A heart arrhythmia?
yeah,
Okay.
other than that.
Can you tell me a little bit more about this heart arrhythmia that you
Yes,
know of?
so we noticed it about a year ago. It basically comes and goes. Usually happens when I'm laying down at night. It almost is like it skips a beat. So you'll feel 1, 2, 3, it'll stop, and then it'll start over again. 1, 2, 3, 1, 2, 3.
Any chest pain when you have
No.
that? Okay. Do you pass out or anything or
No.
feel dizzy?
No.
Okay, good.
I
And
mean,
you're
I can feel it, but it's just an annoyance in the back of my neck. So
okay. And you're following up with a cardiologist for that?
that's correct.
Are you taking any medications?
No.
Are you taking any supplements over the counter or
Yeah, I take 1,000 milligrams of fish oil, multivitamin, um, and some NMN.
okay. And is your provider, your primary provider, aware of that?
Yeah.
Okay. All right, very good. So we're going to start with the psychological aspect of
Okay.
this assessment first. I'm just going to do a quick mood check on you. How have you been feeling lately?
Uh, I'd say okay. I feel like I've been getting down uh, more than usual.
Okay. You've been having some sadness, would you say? Feelings of
Yeah,
sadness?
just that come out of nowhere.
Okay. Has anything happened recently that could have
Yeah, I mean,
caused it?
I did. We did lose our dog of 10 years about a week ago. So, um, yeah, I think it's amplified that
Okay.
now. So,
Okay. Have you felt this kind of sadness before your dog passed away?
yeah.
Yeah. Okay. So you've kind of had this feeling before you've experienced it, and then the passing of your dog has kind of exacerbated it.
Yeah.
Okay. And would you say this feeling of sadness lasts all day, all day long?
Uh, I say it comes and it goes
Okay.
throughout the day.
Okay. And would you say it happens every day? The
Uh,
sadness?
I would say yeah.
Okay. Alrighty. Um, So have you, with this sadness, have you lost interest in things that you used to do? Like if you were an active person.
Yeah, I think I've go to the gym less. I hang out with friends less. Yeah.
I'm just gonna have you turn okay, so you have had like a loss of interest and like interest and loss of like pleasure in things that you used to enjoy.
Hmm.
You said that you don't go to the gym as much as you used to. Have you been? Do you feel like you've been sleeping more, or maybe even eating more?
I think eating more for sure.
Okay.
I feel though when I get anxiety or stress, I tend to eat more.
Okay.
So
Okay. Have you noticed any changes in your weight?
it fluctuates. Yeah, I can gain a bunch in a day and then lose a bunch the next day. It's been fluctuating for a while.
Okay. How about with it in relation to like your sadness? When you're feeling these periods of sadness, do you think that you find yourself eating more or eating less?
Eating more.
Eating more.
Yeah.
And what about with sleeping? Do you feel yourself sleeping more or sleeping less?
I would say sleeping, probably sleeping more.
Sleeping more.
Yeah.
And when you're sleeping, do you have a restful sleep or do you find yourself tossing and turning, maybe even having nightmares or
Yeah, tossing and turning for sure.
tossing and turning a
Yeah.
lot? Okay. That must be scary
Yeah.
and not having just not a restful sleep can make you probably tired more during the day.
Yeah.
Okay, I see. And do you think that you're kind of just moving slowly throughout the day, kind of sluggish, or has it been the opposite way where you're fidgeting more and you can't really sit still or anything?
I think I get periods of both. Usually in the morning it's more fidgety, but at night it's more of the slowdown.
Okay. You mentioned a little bit ago that when you get anxious or stressed, can you tell me a little bit more about that anxiety and how you feel during that time? Is there anything physical that happens to you? Do you have heart palpitations, like or a faster heart rate, or do you start shaking, sweating,
Yeah, maybe sweating
sweating?
a bit. Heartbeat possibly, um, but more of a spiral up here of just the anxiety that's going on. Um, yeah.
This anxiety and sadness that you're feeling, can you pinpoint it to anything? It sounds like you've been kind of experiencing this for a little while now. Other than your dog passing recently, is there anything um, that you're excessively stressed out about or sad about, or is it just like it just is like a baseline feeling that you're
I
experiencing?
think it's a baseline feeling
Okay.
that I'm experiencing.
Okay. Does anybody in your family have anxiety or depression?
Um, Not that I know of.
Okay. Do you take any recreational drugs or to kind of help with that feeling, or drink alcohol?
Yeah, I do marijuana to
Okay.
help with that feeling.
Okay. And how often do you
Probably
partake?
once or twice a week.
Okay. Once or twice a week. Does it help?
Yeah.
Okay. Is there anything else that kind of helps subside that feeling?
Not usually. No.
Not usually. Okay. What about alcohol? Do you use alcohol?
Yeah.
Okay. About how often do you drink?
Twice a week.
Twice a week. And when you are drinking twice a week, is it alone or with the company of others?
Usually with the company of others.
Okay. And what do you drink? What's your preference to
Beer.
drink? Beer.
Yeah.
How many beers would you say you drink in a night?
2 or 3.
2 or 3. Do you ever drink more than 6?
No.
And do you ever feel like you don't have control over your drinking or control over what you're ingesting with the marijuana? Okay. Okay. And has anybody ever told you that you have a problem with the marijuana or the alcohol?
No.
Okay. Alrighty. Is there anything else that you do to help with the stress?
I feel as though I used to work out to help with the stress, and maybe it's just not doing what I needed to do anymore. So
Okay. Do you ever feel like a feeling of worthlessness or guilt?
yeah.
Yeah. Can you tell me a little bit more about that? Do you ever like how often does that worthlessness or guilt
Not every day.
every day? And how long do you think that you can remember it feeling that way? In the last 2 weeks, the last 6 months, or longer?
Probably last 6 months.
Last 6 months. Okay. And there's nothing that you can think of that
No.
kind of made you feel this way? Okay. Okay. Do you have a job?
Yeah.
Okay. How's your job?
It's good.
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 Okay. Do you feel like you make an adequate living?
Yeah.
Okay. Good. And what about your friends? Do you have a social circle or support?
Yeah. I mean, I did at one point. I think I smaller that circle to family and select friends.
Mm-hmm.
Um, but yeah, I don't have a kid now, so
Okay.
that pretty much takes up all my time.
Are you married?
Yeah.
Okay. And how many children do you have?
One.
One.
All
Okay.
children.
And are you involved in any like religious organizations or any community organizations?
No.
Okay. Do you follow a religion or anything?
I follow all the religions.
You follow all of them. Okay. Are you an active member of a
No,
church?
I just do a lot of reading about
do
religion.
Okay. All right. Do you feel like that is maybe an outlet for you, or is it just an interest?
Just interest.
Just an interest. Okay. Does it help with the anxiety or the depression?
No.
Okay. Is there a community of people that are around you that maybe follow those same interests in all of those religions?
It's possible. The world is filled with millions of people, so yeah.
Okay. All right. Very cool. Do you feel like that you've been maybe losing concentration, or you just can't focus
Yeah.
whenever you're having these
Yeah.
feelings of sadness?
Yeah, I
and stuff?
focus on those feelings and it kind of spirals. So
When you're going through these feelings, do you find that it affects your work life or whatever
Not
whatever
yet.
you're doing?
Yeah, I mean, not. I could see it progressing to that, but
Mhm.
at this point, no.
Have you ever taken medication for these feelings?
No.
No. Okay. All right. Do you think that the sadness and anxiety that you feel like impacts your job?
Maybe it does, and I'm just not aware of it. So.
Like, have you ever skipped work because of it, or felt like you just couldn't get out of bed?
Yeah, I mean, that could get at that for sure.
Okay. Um, have you ever felt like you wanted to harm yourself, or that you would maybe the world maybe would be better off?
Yeah, I think I've thought definitely that the world would be better off, or who would miss me, or you know.
Have you ever had thoughts of harming others?
No.
Okay.
No.
Let's go back to these ideas of self-harm. Have you ever contemplated suicide with a plan or a realistic thought of actually harming yourself?
No.
Okay. And
Not
then
with a plan, but no.
But you have had feelings of severe sadness where you thought maybe that okay. How are you feeling right now? How are those feelings of sadness and maybe like of the world not with the world being better off without you? How are you feeling in this moment? Do you still feel that way?
No. I mean, I feel anxious. Um, probably because, we normally don't talk to anybody about this, and this is, you know, first time speaking about it, so, yeah, anxious to a certain extent, but more of a relief, I guess.
Do you feel like you can talk to your wife or your friends or your family about stuff like this?
Yeah.
Okay.
But then it's like, do I put that burden on them? It's tough.
Okay. Has your sadness or anxiety impacted your relationship?
I don't know.
I would be, I think it would be beneficial for you to speak with a therapist. And we can work together on getting you the right therapist and getting you some, we call it cognitive behavioral therapy.
Okay.
Um, I think that you could benefit from discussing how you're feeling with them. I also think that you could benefit from maybe getting on an antidepressant, an SSRI, such as either Lexapro or Zoloft.
Okay.
Have you heard of those medications before? Okay. Um, and I forgot to ask you earlier. Do you have any allergies?
No.
Okay. So we would probably want to start you off on a low dose antidepressant, and then after a few weeks, we'd probably see how you're feeling because it does take some time for it to get into your system,
Oh.
and see how you're feeling from there, and discuss the need of going up and down on your medication. I would encourage you to try not to participate in the recreational drug use, and limit the drinking as much as you can. But thank you for sharing that
Yeah.
information with me. Um,
Doctor-patient continuity. Right.
yes, this is a confidential conversation. Everything that you say here is will only stay amongst us and my professor who is watching this
Oh,
video.
okay. Cool.
Is there anything else that you're concerned about that you'd like to discuss at this time?
I don't think so.
Okay, I'm going to move on then to the biological assessment. So I'm going to be doing essentially a head-to-toe assessment, a physical. Is there anything that is achy or abnormal that you would like me to focus on? Anything that hurts more than it should, or, or, or any concerns that you might have about your physical body?
No.
Okay, alrighty. So I'm going to start the head-to-toe assessment. Okay. First, we're going to start with the head. Let's actually have you turn towards the camera. Okay. Alrighty. So with just a quick visual, I'm just going to have you look at me a little bit. Quick visual, I don't see any abnormalities of the face. The head is normal cephalic. It's pink. The skin is vascular. It is the appropriate color for his ethnicity. I'm not seeing any obvious signs of trauma or skin issues. I'm going to start feeling your scalp and looking into the hair. So he appears to be well kept. He is not does not appear to. He's well groomed. He's well nourished appearing. The scalp is not dry. I don't see any excessive flaking. His hair is full. There's no premature alopecia. The hair itself is soft. Um, it appears to be very healthy. Um, he appears to be the stated age, and that he is not older or any kind of acute distress. There's no acute distress. Okay. I'm going to have you look at me again. I'm going to start on your eyes. I'm going to be bringing out my ophthalmoscope here, and I'm going to just shine a bright light into your eyes. And what I'm looking for is for pupillary dilation and constriction. Okay, I'm going to shine this light into your eye. I want you to just look at me. Very good. So I'm seeing appropriate pupillary constriction when I shine the light in, and dilation as I pull it away. Pupils are equal, round, and reactive to light and accommodation. When I do shine the light on one eye, the other eye appropriately mimics the other eye. I am going to just take a look at me a little bit more. The sclera is yellow. There's no redness or jaundice. I don't see any excessive tearing or drainage coming out of the lacrimal duct. Conjunctiva is pink, does not appear to be infectious. The eyelids are also pink, flesh toned. Eyelashes don't have any obvious crusting or missing eyelashes. There's no signs of infection in the eyes. I'm going to now have you take a look at me, and I'm going to test the motor functions of your eyes, okay? And what I'm going to have you do is you just stare at me. I'm going to be moving my finger, and you only move your eyes following my finger, okay? Here we go. Follow my finger with your eyes. Okay, very good, very good. Next, I'm going to be checking your peripheral vision. So I'm going to be holding my hands out here, and I want you to look at me. And once I start wiggling my hands, I want you to let me know when I'm doing it. Okay? Ready? No, don't look. Just look at me, and then tell me when I'm wiggling. Okay? Ready?
Wiggle.
Okay, very good. Your peripheral vision is intact. Do you wear glasses or anything?
Yeah, I wear blue blockers when we're at work.
Okay, very good. But do you have any issues with your vision? Any strain on your eyes?
No.
Have you had any headaches recently from staring at the screen or anything? Any headaches right now?
No.
Okay, good. Okay.
I'm tired.
A little tired. Okay.
Yeah.
I'm going to take a look now at your ears.
Okay.
I'm going to be shining this light into your eyes. Have you been having any ear pain recently? I'm just moving your hair back.
No, luckily I just cleaned my ears. So
Okay, very good.
Should be a clean ride on in.
Okay, I'm just going to first visualize. I don't see any redness around the ear. The ear shape appears to be normal. It's pink. There's no drainage or lesions that I see on the ears. Have you ever had difficulty with hearing?
No.
Okay, and you don't wear any kind of. Okay.
Nope.
All right, I'm just gonna pull the ear down a little bit. I'm gonna be looking inside of the ear. Okay, it is clean. It does look like you just cleaned your ears. Very good. And I'm actually not seeing too much earwax or cerumen in the ears. There's no obvious signs of infection on the inside. There's no pimpling or drainage inside the ear either. I'm going to just do a quick little auditory assessment. I'm going to whisper a word into your ear, and I'd like for you to repeat it to me, okay?
Baseball.
Yes. Okay, I'm going to do the same thing with the other ear, okay? I'm going to take a quick look, and then we'll do the auditory assessment. I'm going to come around, and I don't see any obvious drainage or signs of infection here. Just going to take a little quick visual, and then I'm going to shine my light. And again, the ears are very clean. No lesions or drainage coming out of the ears. Very good. Okay, I'm gonna now repeat the auditory assessment, okay? I'm gonna say a word and you're gonna repeat it back to me, okay? Ice
Lala. Oh, ice cream. Sorry. Keep going.
cream. Okay, very good. Yes, I said ice cream. Alrighty, I'm going to now take a look at your nose. Have you had any drainage coming out of your nose recently? Okay. It is cold and flu season, so sometimes it is common for drainage to be coming out of your nose. I don't see any obvious crusting around the nose or any drainage, just on a quick visual. Your septum appears to be midline. I'm going to shine this light back in your nose as well, okay? Just gonna take a look here. The nasal cavity is pink, and I don't see any excessive drainage, no lesions inside of the nostrils. The nasal septum is midline. A little bit of redness under the nose, but nothing to be concerned about. You have any trouble smelling?
No.
Okay. I'm just going to be feeling your sinuses on your cheeks, okay? Let me know if it's painful at all. Any pain when I press?
No.
Very good. Okay. Okay, no pain? Okay. Okay. I'm gonna move on to the oral cavity now. And his mouth is, I don't see any obvious lesions or ulcerations. The lips are pink. There's no cuts or bruising there. No obvious trauma or gross deformities. I'm gonna actually press I'm gonna press right here, and I want you to open your jaw for me and then close it. Just good. Just testing that TMJ, and then have you open your mouth again. I'm gonna shine the light in your mouth, and we'll assess that. Alrighty. So he has a pink oral mucosa. The buccal membrane is pink as well. It's moist. The tongue is pink without any crusty lesions on the tongue. Can you stick your tongue out for me and move it side to side for me? Very good. He is following directions appropriately. I'm going to have you open your mouth again. And then I just want you to turn your tongue a little bit so I can see under it. Very good. I'm going to look at the other side. Very good. He has appropriate dentation. His teeth are clean. I do not see any obvious cavities, and there's no halitosis. His soft and hard palate is pink and intact. I'm going to have you just stick your tongue out one more time. I'm going to look at the back of your throat. The uvula is also intact and functioning appropriately. You can put your tongue back in your mouth. Do you go to a dentist?
Yeah.
Very good. How often do you go to a dentist?
Every 3 months.
And
Right
okay. How often do you brush your teeth?
Twice a day.
And what about with flossing?
Once a day.
That's good. Good. Very good. You have nice, healthy, strong teeth from what I can see. The head is not very striking at all as far as abnormalities. He looks very normal. He does not appear to be in any acute distress. So I would say the head, eyes, ears, nose, and mouth are all within normal limits. The neck, if you can just bring your hair back a little bit, I'd like to take a better look at your neck. Okay, and I can see that the trachea is midline. I'm not seeing any bulging or any swelling of the neck. I'm just going to come behind you and I'm going to feel the thyroid here. Okay. Any pain when I touch?
No.
Okay. Alrighty, very good. While I'm here, I'm just going to palpate one of the carotids. Very good. Very good. And I'm also just going to be feeling the lymph nodes here. And I'm not feeling any enlarged lymph nodes either. And I'll go to the back. Okay, very good. Just gonna feel here. not feeling any enlarged lymph nodes. Um, do you? I'm just gonna go back and do a little bit of a mental assessment on you. Maybe just to see your memory. Sometimes when people feel depressed or anxious, they can have a reduction in their memory. So I'm just gonna say 3 words, and I'll ask for them later, okay?
Okay.
And I'd like for you to repeat them back to me. So it's gonna be shoe, cherry, and brush.
Okay.
Okay?
Yep.
Alrighty. Um, how what level of education do you have?
Associate's degree.
Okay, so college.
Yeah.
Okay. Are you currently in school or?
Yeah.
Okay. And I'm gonna ask you just a couple of questions. Do you how are these 2 words related? Blue and yellow.
They're both colors.
Okay. And I'm going to have you do just a mathematical question. What is 100 times 20?
2000.
Yeah. Okay, very good. Are you able to count backwards by 5 from 100?
Yeah.
I'll let you know when to stop.
Okay. 100, 95, 90, 85, 80, 75, 70, 65, 60.
Very good. Okay. Alrighty. I'm going to move on to the assessment, and I'm going to start taking listen to your heart and lungs and your belly. For this assessment, I'm just going to have you lay down. That way, I can get a better listen. Okay. Alrighty. I'm just going to put this pillow under your head. Okay, alrighty. Any chest pain right now?
No.
Okay. So the chest appears to be symmetrical. There's no obvious like palpitations that I can see. He's not endorsing any chest pain or difficulties with his breathing. So I'm just going to be taking my stethoscope and I'm going to be placing it over your chest. I will be lifting up your shirt to do this. And the stethoscope is a little bit cold, I'm sorry. Okay, and just lift up your shirt. Okay, again, chest is symmetrical and no, I don't see any obvious palpitation here. I'm gonna just take a listen. Okay. He does appear to have a normal rate and rhythm. I would be in the office setting should be listening to the heart for a full minute, but just in the sake of time, we're not going to be doing that. But I don't hear any ectopy or any rubs, gallops, or arrhythmias as of right now. With his history of an arrhythmia, I would like to have an EKG completed before the end of this visit, and that's just to get like a picture of your heart, an electrical picture of your heart, just to see what rhythm that you're in while you're here.
Yeah.
Okay. Alrighty. I'm gonna now move on to listening to your to the lungs. Okay. I just want you to when I press my stethoscope on you, I'd like for you to take a deep breath. Okay. All right. Take a deep breath. Very good. Good. He's got adequate chest rise. I'm just going in a zigzag pattern to assess all of the lung fields of the anterior stomach. Very good. very good. Any trouble breathing?
No.
Have you ever been on oxygen?
No.
Okay, I'm not hearing any wheezing. His lungs are clear. There's no rales or coarseness of the lung fields. Okay. The chest is even. I don't see any labored breathing. He doesn't have a history of asthma or any kind of suspicious breathing issues. Hasn't had any infections or upper respiratory infections that we know of. All right, I'm going to take a look at the belly now. The belly's flat. I don't see any obvious peristalsis going on. There's no obvious bulging in any of the quadrants. The belly's flat. It is soft. There's no obvious ascites. It's not rounded. It's not distended. So now I'm going to take a listen to your belly. Okay. When was the last time you had a bowel movement?
This morning.
Okay. And are you passing gas?
Yeah.
Okay. Okay, just gonna take a quick listen.
How many bowel movements do you have per day?
It varies, but typically one a day. But every person varies. Okay, very good. You are his bowel sounds are normal active. I'm going to now palpate the belly. Okay, you let me know if there's any pain when I palpate. Okay, I'm gonna go soft first. Any pain or tenderness? How about there? Okay, I'm gonna go a little bit deeper this time. Okay, pain?
No.
Good. Okay, I'm not feeling any bulging or any kind of organ megaly. His belly is soft, it's non-tender, there's no rebound tenderness. He's not complaining of any pain. I'd say that this is a normal abdominal assessment. You can actually bring your shirt back down and sit up for me, and then I'm going to take just a listen to your back as well. Alright, take a deep breath. Good. Deep breath. Deep breath. Very good. Very good. Good. While I have you sitting up, I'm going to just be assessing your back. Just sit straight up. Okay. So his posture is normal. I'm not noticing any asymmetry of the shoulders. His back is, I don't see any abnormalities of the spine either. Okay, I'm just gonna put my hands on your shoulder. I want you to shrug your shoulders. Okay. Any pain when you do that?
No.
Okay. Can you just move your head from right to left? Very good. Any pain of the neck when you do that? Okay. I'm just gonna palpate the spine here. Pain?
No.
Okay. And I'm just going to be going down the spine. Let me know if there's any tenderness. Okay, very good. Any pain here?
No.
Okay, so the kidneys are not painful. That's good. How is your diet?
Great.
What do you feel like you eat 3 meals regularly?
No. No. I mean, for what I do, I'm a faster, so I usually don't eat until 1 o'clock. Fast for 16 hours, and I eat for 8. So.
Okay. Alrighty. And what are you doing that for? To
better my life.
Okay.
Yeah.
Alright. That's cool.
And it works better for me. I maintain weight. I don't eat as much. My body has a chance to heal.
Okay. And how about your bowel habits? Do you feel like you go to the bathroom regularly?
Yeah, at least once a day.
Is it solid? Is it loose?
Usually solid.
Okay, very good. All right. Any concerns for your belly?
No.
Okay. What about with urination? How any burning or pain when you pee?
No.
Okay. And what's the relative color of the urine?
Like yellow.
Okay. And is there any? I'm gonna actually have you lay back down, and I'm gonna take a little bit of an assessment of the lower part of your body.
Okay.
Okay. And what I'm going to do is I will actually be pulling your pants down slightly, but not exposing anything. I'm just going to be assessing for hernias. So checking for femoral hernias. Any pain here? No. What about here?
No.
Okay, very good. At this time, we could also perform an assessment of the genitals. With him being a 35-year-old man, the expectation would be that he would be a fully grown man with no longer in puberty, but we would expect pubic hair. We would be expecting a fully adult man. The testicles should be in place. Do you have any pain when I press here?
No.
Okay, very good. Just assessing the inguinal hernias here. Okay, very good. And you could also assess the pubic area and testicles. Make sure there's no lesions or drainage or any concerns for STDs or STIs. You are married, but if you are not looking to have another child, we do always encourage using protection.
Yeah.
Okay. Alrighty, I'm gonna have you sit back up. Alright, we're just gonna move on. Do you remember those 3 words that I told you to remember?
Chair, chariot, car. Is what I remember.
No, those were not the words that I told you to
Okay.
remember. Do you want to try again?
I don't remember.
Okay. Cherry, shoe, and brush were the words that I told you to remember. Have you ever had difficulties with your memory in the past?
Yeah.
Okay. Can you elaborate on that?
Just forget things.
You just forget things.
Mm.
Okay. Has that happened more so with your when you're feeling anxious or sad?
Yeah.
You think so? Oh, okay. Alrighty. That's understandable. Okay. Alrighty. So that's definitely something that would be concerning. So we'll have to evaluate that further. Okay.
Okay.
Do you ever are you ever like driving and you kind of forget where you're going?
No.
Okay. Alrighty. Okay, I'm going to be now assessing the musculoskeletal system real
Mhm.
quick, and then we'll be ending our assessment, okay? I'm going to be handing you my hands, and I want you to squeeze, and then pull me towards you. Very good, push me away. Very good, I'm going to have you bring your arms out. I'm going to press down on your arms, and you're going to stop me, okay? Good. Now, you press down on my hands. Very good, alright. Any pain in your arms? How about pain in your legs? Okay, very good. Alright, and I'm going to do the same thing with your shoulders, just a little shrug. Very good. Alrighty, now I'm going to, why don't you lay down and we'll take a look at your legs as well. Okay, you lift up your legs. Okay, I want you to lift up this leg and bring it down. Okay, now up. Very good. This one. Good, and down. And I want to, you have any numbness or tingling in your feet?
No.
How about your hands?
No.
Okay. Can you press down? Can you pull back? Very good. Can you bend your knee? Any pain?
No.
Okay, do the same thing here. Alrighty. Very good. I'm going to have you sit back up. So, the patient does endorse signs of feeling sad, having some anxiety as well, which we can make a treatment plan for him, and I would encourage some therapy as well as trying a low dose SSRI for right now, as well as taking out some of the recreational ways of managing that stress and anxiety. The patient states that he does feel sad, and I do think that that's consistent with how he appears right now. His mood is consistent with what he is stating. Um, he does have a linear form of thought, and doesn't currently endorse suicidal ideation, but that is something that we should be following up on. And there is a little bit of a concern with his memory. That may just be situational, being put on the spot for this video. However, it also can be a sign of his anxiety or depression that he might be feeling. Other than that, thank you. Thank you so
Thank you,
much
Doc.
for coming in, and
Appreciate you.
we'll get you we'll get an EKG, and we'll set you up with some options for therapy, as well as a low dose medication,
Okay.
and we'll go through that information with you. Okay.
Okay.
All right. Thank you for coming in.
Yeah, no problem.